Choosing the right treatment for prostate cancer can be one of the most difficult and confusing choices in medicine. There are two key choices to make: which therapy and which center. Both are crucial. Let's look here at the argument for radiation therapy. Dr. Ted DeWeese is a radiation oncologist at Johns Hopkins, a nationally ranked center of excellence.
More patients than ever are being treated with radiation therapy given its excellent long-term outcome compared to surgery and its decreased side effects also compared to surgery.
The most popular radiation therapy implants radioactive seeds in the prostate itself. Called brachytherapy, the radiation breaks the genetic material or DNA in the tumor cells to kill them. The biggest advantage? Time. Just 2 to 3 hours for the procedure and you're done. The chief side effects are rectal bleeding, an increase in urinary frequency, impotence at about 30%, which is similar to other radiation and to state-of-the-art surgery.
If you were to undergo treatment with brachytherapy, one of the important side effects could be impotence or problems with the erections.
The next radiation therapy is called IMRT. This is for patients with cancer on both sides of the prostate, cancer breaking outside of the prostate, an aggressiveness score of 7 or more, and a PSA of 10 to 20.
IMRT stands for intensity modulated radiation therapy, a very sophisticated way to give multiple tiny beams, up to 3,000 separate beams of radiation directed all to the prostate, so it can give a high dose to the prostate and minimal to no doses elsewhere.
For larger tumors, later stages, and for patients with symptoms, IMRT is the right choice. A few centers also offer proton therapy. The chief advantage is a much longer treatment program.
It also has a risk of side effects, including about a 40% risk of impotence, about a 6% risk of painless but persistent rectal bleeding.
Hormonal therapy is added for more advanced disease.
If you had a more advanced prostate cancer with higher grade or higher stage, hormonal therapy in addition to radiation has been shown to actually increase the cancer control and extend life.
The biggest advantage of radiation therapy is that training and technology is more evenly applied across the country than surgery. So if you don't live near a top surgical center, radiation can be a better choice. Look for centers doing several cases a week or over 100 per year. Now, the one thing we haven't talked about is survival. The bottom line is that there are no long-term trials that tell you what happens after 30 years. Surgeons would argue if you're a young man with an early-stage tumor, you want to get it all out. We'll look at that in another video in our series.